If you're over 60 and still masturbating the same way you did in your 20s, you could be slowly destroying your penis and not even realize it. I've seen men walk into my office proud of their routines, only to break down in tears when they find out those habits are the reason their erections have weakened, their sensation has faded, and their confidence has vanished. What they thought was harmless was silently causing permanent damage. I'm Dr. Mohit Kara. I've been a men's health specialist and urologist for over 3 decades. I've operated on thousands of penises, counseled countless older men, and helped patients recover their sexual health, dignity, and peace of mind. And I'm speaking to you now because I don't want you to become another preventable case, not when it's still within your control. You've probably been told that masturbation is safe, natural, even healthy, and for the most part, it is. But after 60, everything changes. Your blood vessels, your skin, your nerves, your prostate, they don't respond the way they used to. What once gave you pleasure may now be putting your body at risk. But here's the good news. Once you understand the 5 most dangerous masturbation mistakes older men make, you can start reversing the damage, improving circulation, restoring sensation, and unlocking a more connected, fulfilling relationship with your own body. And what's most surprising, almost every senior man I've treated is making mistake number 1. Before we begin, if you're serious about protecting your sexual health as you age, make sure to subscribe and turn on notifications, so you never miss vital advice that could save your function, your confidence, and your future. And if this message speaks to you, type 1 in the comments. If not, type 0. Your feedback helps me create better, more meaningful content for you. Alright, now that you understand why this matters so deeply, let's get into the first and perhaps most dangerous mistake older men are making when they masturbate. It's something I see almost every week in my clinic. Most men have no idea they're doing it. And yet, it's quietly damaging their sensitivity, restricting blood flow, and over time, ruining their ability to enjoy real intimacy. Let's talk about the death grip. Mistake 1. The death grip dilemma. I wish I could count how many times older men have come into my office frustrated, confused, and embarrassed because they can no longer feel the same pleasure they once did. They tell me their erections aren't what they used to be. That climax feels dull, that something's just missing. And every time, I ask them the same question. How exactly have you been stimulating yourself? Almost always, the answer reveals one of the most dangerous habits I see, what we call the death grip. It sounds dramatic, but the name fits. The death grip refers to using excessive pressure during masturbation, squeezing too hard, too fast, and too aggressively. It's a habit many men unknowingly develop over the years, especially if they're chasing a quick release. But here's the problem. After age 60, your penis simply can't handle that level of force like it used to. The skin becomes thinner, the blood vessels become more fragile, the nerves, especially the fine ones responsible for sensitivity, are more vulnerable to pressure damage. And yet, with each tight stroke, you may be cutting off circulation, creating tiny micro-tears, and even damaging the nerve pathways that control pleasure and erection. Some men eventually come to me with permanent sensitivity loss, others with reduced size due to internal scarring, a few with Peyronie's disease, curvature caused by repeated trauma. And the worst part? Most of them had no idea they were doing this to themselves. I'm telling you this not to scare you, but to wake you up. If you're using the same grip and technique you used decades ago, it's time to stop. Your body has changed. What once felt normal can now be destructive. You owe it to yourself to be gentler, to treat your body like it matters, because it does. Every stroke matters now. Use lubrication. Soften your grip, slow your rhythm, and be present with what your body is telling you. That's how you preserve sensation, restore blood flow, and reclaim pleasure, not by forcing it, but by respecting it. Now, while this is one of the most harmful physical mistakes, what you're about to learn next goes even deeper, literally. Because mistake number 2 doesn't just affect your skin or your grip. It targets your prostate, and it can leave lasting discomfort most men never see coming. Let's talk about it. If you're still here and this message is resonating with you, drop a number 1 in the comments to let me know you're paying attention and ready to take charge of your health. Now let's keep going. It's time to talk about the second mistake you absolutely need to avoid. Mistake 2. Masturbating without lubrication. I remember one patient in particular. He was 72, retired, and still sexually active on his own, which is something I always encourage. But he came to me with irritation, discomfort, and a deep worry that something was seriously wrong with his penis. After a few questions, I discovered the problem. He'd been masturbating dry for decades. No lubricant, no protection, just skin-on-skin friction. And now, after years of doing it that way, his body had had enough. Masturbating without lubrication might not seem like a big deal, especially if it's what you've always done. But I want to be clear. After 60, this is one of the easiest ways to injure your penis without realizing it. Your skin isn't the same as it used to be. It's thinner, more delicate, and slower to heal. Each dry stroke causes tiny amounts of friction. And over time, that adds up to irritation, microabrasions, and eventually scarring. Some men start noticing their shaft feels rougher, less sensitive, or even tighter than it used to. That's not just age, that's damage. Repeated friction without lubrication can slowly wear down your skin's natural defenses, reduce elasticity, and inflame the tissue. Once inflamed, the penis is more prone to injury and in some cases can develop hardened patches beneath the surface that permanently alter texture and flexibility. It's not just about comfort, it's about preserving your ability to feel pleasure and avoid painful complications later. And the truth is, there's no excuse not to use lubrication. Whether you prefer water-based or silicone, the right lubricant reduces friction, protects the skin, and allows blood to flow more freely, something that becomes even more critical as circulation naturally decreases with age. If you've never used lubricant, I urge you to start, not just once, but every time. Make it a habit. This one small change can protect your penis for years to come. It's about showing your body the respect it deserves, because once the damage is done, it's not always easy to reverse. Now, while skin irritation and sensitivity loss are bad enough, what if I told you the next mistake could actually affect your internal health, your prostate, your urinary system, even your hormonal balance? This is where things get even more serious. Let's talk about the danger of ignoring what your body is trying to tell you, especially after climax. Mistake 3. Ignoring prostate feedback. One of the most overlooked dangers I see in older men isn't something you can see in the mirror. It's what's happening deep inside, specifically in your prostate. And sadly, by the time many men realize something's wrong, they're already living with discomfort they didn't have to endure. The truth is, ignoring what your prostate is trying to tell you, especially during and after masturbation, is a mistake that can quietly harm your sexual function, your comfort, and your quality of life. I've had men in their late 60s and 70s come to me complaining of a dull ache between their legs or a strange pressure behind the scrotum after climax. Some describe it as a burning sensation in the urethra. Others feel like they didn't completely empty their bladder. These aren't random aches of aging. They're signs of an irritated, overworked, or inflamed prostate. And too often, it's connected to how frequently and forcefully they've been stimulating themselves without giving their body time to rest and recover. The prostate is a small gland, but it plays a massive role in your sexual health. It produces the fluid in your semen, and it's connected to the nerves and blood vessels that support erections. As you age, it becomes more sensitive and more vulnerable to swelling, especially if you're masturbating too often, too quickly, or without paying attention to how your body responds. What many older men don't realize is that repeated ejaculation without proper rest can congest the prostate. Over time, this can lead to chronic inflammation, known as prostatitis. It's uncomfortable. It affects your ability to enjoy climax. It can even interfere with urination and reduce your erection quality. And it's not something a pill will just magically fix. That's why I tell my older patients, masturbation isn't a race, it's a conversation with your body. And if your body's telling you to slow down, to rest, or to change something, listen. Pain, pressure, or discomfort after climax isn't just getting older. It's a warning sign. Now, up to this point, we've talked about physical habits, your grip, your lubrication, your sensitivity to internal feedback. But what if the real danger wasn't just physical, but neurological? What if the content you're watching is silently rewiring your brain, affecting your arousal, and destroying your connection with real-life intimacy? Let's talk about what's happening inside your mind. If you're still watching and these insights are hitting home for you, go ahead and comment the number 1 below, just so I know you're here and taking this seriously. Now, let's keep moving forward and dive into point number 4. Mistake 4. Watching high-stimulation porn too often. This one hits a little deeper, because it's not just about your body, it's about your brain. Over the years, I've had countless older men sit across from me and say, "Doc, I don't get it. Everything works when I'm alone, but the moment I'm with a real partner, nothing happens." And often, the root cause isn't physical, it's neurological. Specifically, it's their long-term use of high-stimulation pornography. I want to be clear, this isn't about shame. I'm not here to tell you what you can or can't watch, but I am here to explain what happens to the male brain when it's exposed to constant, artificial, high-intensity arousal, especially after 60. See, your brain is incredibly adaptive. It learns patterns fast. And when you feed it an endless stream of novelty, speed, and exaggerated sexual imagery, it starts to rewire how it experiences pleasure. That means your brain can start responding more to the screen than to real touch, real connection, or even real people. It's not that you've lost interest, it's that your reward system has been hijacked. And the longer this goes on, the harder it becomes to feel aroused without it. What's worse, this mental conditioning affects blood flow, erection quality, and the release of key neurochemicals like dopamine and oxytocin, chemicals you need for intimacy, bonding, and satisfaction. I've seen men who once had strong, healthy sex drives become dependent on digital stimulation just to feel anything. And it's heartbreaking, because with time and the right habits, this can often be reversed, but only if they recognize it early. If you're watching porn regularly and finding that real-life intimacy feels dull, distant, or even stressful, that's your sign. Your brain is telling you it needs a reset. Take breaks. Reduce your screen time. Try masturbating without visual stimulation and reconnecting with sensation, breath, and presence. Train your body and mind to enjoy real, grounded pleasure again. This shift doesn't happen overnight, but it can restore the kind of fulfillment that no screen can ever replace. And while mental conditioning can rewire how your body responds, the final mistake we need to talk about may be the most subtle of all, because it's not about what you're doing wrong physically or mentally, but how you think about masturbation in the first place. Let's talk about that. Mistake 5. Not treating masturbation as a health practice. Out of all the mistakes I see, this one might be the most misunderstood, because on the surface, it doesn't look like a mistake at all. But for men over 60, the way you approach masturbation isn't just about pleasure anymore. It's about health. And when you treat it like an afterthought, something rushed, automatic, or purely mechanical, you risk far more than you realize. I've had older patients tell me they masturbate just to fall asleep, or to relieve stress, or simply out of habit. There's no intention, no connection, no real awareness of what their body is doing or feeling. Over time, that casual, disconnected approach wears down more than just sensitivity. It erodes your relationship with your own body. You stop listening. You stop noticing the early signs of strain, inflammation, or change. You start to lose the natural rhythm that keeps blood flowing, nerves healthy, and sexual energy alive. Your penis, like every other part of your body, responds best when it's treated with care, when you slow down, when you breathe, when you create an experience instead of a task. Masturbation can, and should, be a time of relaxation, connection, even healing, but only if you see it that way. The danger in treating it casually isn't just physical, it's emotional. It can lead to feeling numb, disconnected, or dissatisfied. It can lead to relying on harsher stimulation or more frequent sessions just to feel something. And in the long run, it can contribute to erectile fatigue, loss of pleasure, and even performance anxiety if you're with a partner. When you make masturbation a mindful part of your health routine, rather than something done in secret or in haste, you take control. You become more in tune with your body's signals, more aware of what feels right and what doesn't. You reduce the risk of harm, and you enhance the experience of pleasure, on your own or with someone else. So if you've been treating masturbation like an old habit you don't think much about, it's time to rethink. Because how you relate to your body now will shape how well it serves you in the years ahead. And that brings us to something I want every man over 60 to hear, because everything we've covered so far leads to one simple, powerful truth. The way you care for your sexual health isn't just about sex, it's about your future. Let me explain why. Conclusion: the truth about sexual health after 60. If you've made it this far, I want to say something from the heart. As a doctor who has dedicated his life to men's sexual health, I'm not here to scare you, I'm here to give you back control. I've spent decades sitting across from men just like you, husbands, veterans, grandfathers, men who worked hard all their lives, provided for their families, and now just want to feel whole again. They come to me not just because something hurts or isn't working right, but because no one ever told them the truth. No one warned them what happens when you keep doing what you've always done, even as your body changes. We've covered 5 masturbation mistakes today. 5 habits that, while they may seem harmless on the surface, can slowly and silently rob you of the very thing that makes you feel alive, confident, and connected. The death grip, where too much pressure deadens sensitivity and disrupts blood flow. Masturbating without lubrication, which damages fragile skin and accelerates tissue breakdown. Ignoring prostate feedback, where small signs of discomfort turn into long-term inflammation and dysfunction. Watching high-stimulation porn too often, which rewires the brain and makes real intimacy harder to feel. And treating masturbation like a chore instead of a health practice, which disconnects you from your body and slowly dulls your natural rhythm and pleasure. These aren't just medical facts. I've seen the pain behind them. I've seen the regret in the eyes of men who didn't know better until it was too late. But I've also seen what happens when they do something about it. When they soften their grip, use lubrication, listen to their prostate, retrain their mind, and approach self-pleasure with respect instead of habit. I've seen men in their 60s, 70s, even 80s rediscover a part of themselves they thought was gone. And I've seen their confidence, their intimacy, even their relationships flourish as a result. So if you've recognized yourself in any of these mistakes, take a breath. You're not broken. You're not too late. You just haven't been given the right information until now. Starting today, you can choose to be more mindful, more aware, and more in tune with your sexual health. And by doing so, you're not just protecting your penis, you're protecting your joy, your connection, your dignity. Because your sexuality doesn't expire at 60, but it does evolve. And the men who evolve with it, who adapt, learn, and take ownership, those are the men who continue to thrive. So ask yourself, what kind of man do you want to be in this next chapter? You still have time, you still have power, and now you have the knowledge to take it back. If this video helped you see things more clearly or gave you something to think about, please take a moment to like, share, and leave a comment below. I truly want to hear from you. And if you'd like to support the work I do and help more men get this vital information, consider making a small donation. Every bit helps me keep bringing this message to those who need it most.